guys? Welcome back to my channel. It's Shay. Thanks so much for coming back for another video. If you're new, welcome, and if you're back, thanks again. So today, guys, we're going to be popping into a nursing video. Most of you guys know here on my channel we do videos on nursing, beauty, and lifestyle. I like to mix it up and give you guys a little jazz so we're not always on, the same topics, and I'm not always talking in front of the camera. But in general today, I'm going to be talking to you guys about a recent accomplishment, and I don't put air quotes to be extra. I just wanted to say just a little accomplishment I made and how I feel about it, and if any of you guys are interested in it, I do have a little bit of some tips for you. So stay tuned. We're going to get right into it. Okay, guys, so I'm going to drop a beautiful picture on the screen for you guys to see because I'm too paranoid to take it off the wall as a prop because I just know me and my clumsy self will not get it back to the perfect alignment that it is in right now. So yes, guys, I have completed a nursing certification as a nurse. If any of you guys are new to my channel, pretty quick synopsis background. I've been a nurse for about 2.5 years. It'll be 3 this summer. I'm working at the hospital where I first started, and I am also working on the unit where I first started as a new grad. So my unit that I currently work on is considered a telemetry neuro unit of our hospital. We do have 2 campuses, and we're considered that unit for the campus we're on. I am on a telemetry neuro unit, but I did decide to take a certification test that was offered to us for medical surgical nursing. And basically, I can tell you guys I made this decision basically based off, one, we were already getting a lot of medical surgical patients. Even though we're a telemetry neuro unit, when beds don't align the way they're supposed to in the hospital, sometimes we get diagnoses that we just don't even know how they even matched up with our floor, but we get them. So I went ahead and took the venture to go ahead and get the certification because it was available. So I will give you guys the deets on what the certification is, what is a nursing certification, do you need it, and then if any of you guys are thinking about the same certification that I got, or a certification in general, I can give you a couple tips and tricks on how I actually studied. So although this seems like it will be a long video, I promise not to keep you guys that long. We're going to go through these quick little spiels and get you out of here so you can get ready to get your cert too. Okay, guys, so for the sake of making sure I'm giving you the correct information, I just pulled up from the certification board basically what a nursing certification is. So it tells you a nursing certification program will give you the opportunity to advance your nursing career and prove your ability to provide the best patient care. It demonstrates your commitment to nursing with this certification, and it also shows your accountability for this program, or basically the specialty. So basically, you guys already know, if you're a nurse, you already know, and even if you're a nursing student, there's certain specialties in nursing. You got your labor and delivery, you got your critical care nurses, you got your med-surg nurses, you got your telemetry nurses, but along with this comes certifications, and the certifications basically are just you testing to show that you have acquired the knowledge between evidence-based practice and along with working in the field. You're applying the evidence-based practice into the field you're working, and you have a good knowledge base of what is required for certain diagnoses and what interventions match up on your floor. So in general, you're just kind of trying to show that you're competent for whatever specialty that you are applying for. There are tons of specialties. People on my floor don't have the same specialty. I know there's nurses who have what is called a PCCN. I got my Cmsrn. It's just a bunch of variety. But in general, you're just trying to show that you are basically competent in whatever specialty or whatever program or certification program you decide to pursue. So the next thing people most of the time ask me, what is the purpose? So I just felt, if you're asking me what the purpose was, I just felt that there was an opportunity for me to not necessarily prove my knowledge, but there was an opportunity for me to get a little bit of growth as the professional I already am. So why not take this opportunity at my institution where I took the test, basically what they did is they provided us with a review course. They paid for this review course. They brought the person in to review this information and kind of guide us on how to study. And then based off that review course, if you passed your test, they actually ended up taking care of most of the cost of the test for you. So that's what occurred with me. I went to the review course, I took my test, I passed my test, and my hospital gave me back the money that I paid for the test. So I said, why not? You guys are providing me this opportunity. It's basically free. A lot of people don't get the opportunity to do this for free, so why I'm not going to take it? An opportunity for growth, knowledge, etc. And at some institutions, certifications will get you more money, and that's basically how I will just put it too. So if I were to apply to another hospital, and even where I'm at with this certification, it's going to, in a way, help me get a little bit more compensation in a program where, versus if I didn't have the certification, I wouldn't be able to go to this level. So in general, people do certify for money, and I don't blame them. And you're also increasing your knowledge. Like, why not? I've been out of school for a while. I think I just felt like, hey, I'm not doing nothing. Let me just sit here and take this test, show that I'm a competent individual, get a couple letters on the end of my name, and just be part of something that's better. Because in general, you're doing the certification to show not only that you're competent, but that you're working towards optimal patient care. And that's the generals. Do you really need it? That's what everybody told me after I took it. Do you really need this test, Shai? Do you really need it to do your job? You don't need this certification to be a registered nurse. A nurse is a nurse. You took your NCLEX. That's what made you a nurse. You're in your state. You got licensed. You're a nurse. But I always look for opportunity for growth, and I always encourage other people, if there is an opportunity in front of you and it's waiting, and I don't want to say minimal effort, but literally all you gotta do is study and take a test, and half of the stuff in the test is things you're already doing as a nurse. So why not take advantage of an opportunity for growth? So we're gonna roll right into the tips and tricks. I'll tell you guys what cert I got if you guys don't already know. I think I already posted it in the beginning, and I'll tell you what I did to basically pass my test. Alright guys, so if you see me look towards the side of my video, I just have some things bulleted out so I can just give you guys the best tips as possible. So in general, any certification, of course, my first tip is know your priorities. And as we learned in nursing school, don't forget to go back to the basics. ABCs. Airway, breathing, circulation. This will get you through a lot of questions on this test, a lot of questions on other tests, and just in general, it's just, even when you're working at work, those are your basics. So knowing your ABCs, even if you're stuck on a question, knowing your ABCs will most of the time get you at least down from 4 answers to 2. The next thing I put is something I learned in nursing school. One of my professors said this, and as much as I cringed with her saying this, I realized that it's helped me with a lot of test taking in nursing. So she said to us, if you could do one thing and go home, what would you do? And that's how you get down to answers in these questions. I use that when I study for the NCLEX. I use that when I study for this test, and it does work. So I had, which I will go into the next step, a test bank book. And it is, we were allowed to have it. It's like practice questions, I should say, not a test bank. It was practice questions. Practice questions to give you kind of examples of what they would ask on the test. And a lot of these questions, as I was going through them and answering them weeks before I took the test, when I really got in a budge on what is the answer, or these 2 answers are the answer, I really sat down and I said, all right, if I could do one thing and go home, what would I do? And I will tell you guys, about 80% of the time, that is the right answer. So if I could tell you, like I said, not even only for the MSN-RN or Cmsrn, but for any specialty, even if you're taking your NCLEX, that is a good test taking mindset. So I already went into the next thing, questions. This is how I study. Even with me going through nurse practitioner school right now, I thrive off answering questions because it gets you in the mode and it gets you in the season for how these questions will be presented to you on an exam. Now, one thing I will tell you guys, this is not the NCLEX. The NCLEX is a lot about strategy, and I hate to say it because I know nurses are going to bash me, but that test is strategy, y'all. I'm telling you. I'm not saying you can know no content and have strategy and go into that test, but if you don't know the strategies of NCLEX, then you won't pass, because they're strategically things done on that exam. But this exam is not meant to be strategic. This certification test, I mean, it's meant to be challenging, don't get me wrong, and it's meant to present you with problems that you would actually have on the floor, but it's not meant to be strategic. It's meant to make sure you know how to take care of these patients, what interventions and what priorities, and how you delegate. And that's it. It's not apples and oranges. It's not a red apple and a green apple. It's not two red apples with different tastes being the answer. This test is a little bit more, I want to say, straightforward. And that's what I think also helped me, because I just took the NCLEX, 2.5 years ago? And while I can't tell you none of the answers, none of the questions, none of even how I studied for that test, I can definitely tell you that taking this test was not comparable. I was like, oh, okay. And it was challenging, but it's meant to challenge you as a professional and to challenge you in the field you're working in. Another thing too, I can tell you guys, on the NCLEX, if I went back and took the NCLEX, like if I could barely remember some of those questions, I'm like, you would not do this at work. But this exam is a little bit more realistic. So there are some things where you're like, okay, this is really what I would do at work. So that's in general, basically. Like I told you guys, I took the review course. If your institution offers a review course, I would encourage it, because these people literally know what, I don't want to say they know what's on the test, but they know, these people who are certified to teach these courses have studied these tests. They've studied these test banks. They know how to prep you for what you got to do. So if your institution offers the test, if they offer to pay for the certification, take advantage, guys. It's 2020. We're taking advantage of all the opportunities we can get. We're trying to get these bags up. We're also trying to get this knowledge up, and we're trying to, you know, acquire a couple little letters in the process. So why not? Do you need it? I encourage everybody, if you have this opportunity to take this test, if you're a critical care nurse and it's your certification test, I definitely encourage you guys to take it. But in general, we're just about progressing and we're about bettering ourselves. So if you have an opportunity and it's there, I believe you got to snatch it and you got to get it good. So in general, guys, these are pretty much my tips and techniques on how I passed this test. It wasn't anything all in depth, but again, quick, simple, and the facts given to you. I do have the title at the end of my name, so I guess I'm listing my credentials right. I'm RN, BSN, Cmsrn. I'll put it down in the below if I said it in the wrong order. But in general, guys, I just thought it was a good opportunity, and it's not even only about the letters and about the money. It's just about bettering yourself and you know, staying up to date on your stuff. You don't always got to go back to school to be a bomb-ass nurse. You can get these certs, you can do your job, you can keep these patients alive, and you're still bomb AF. So, in general, guys, thank you for watching my video. If you are new here, don't forget to subscribe on your way out. Back with another video. If you haven't hit the notification bell already, hit that down there. Leave comments down below. If you guys have any questions, of course, I can never disclose the questions on the exam. I can't even remember the questions on the exam, to be honest. But if there's anything I can do to assist any of you guys, let me know. I will also leave the link down to the book I used for practice questions. Someone is borrowing it, so I couldn't show it to you guys in the video, but I will leave the link down below. And if I have an opportunity to screenshot it, maybe I'll put it to the side of the video right here. Again, I will see you guys in my next video, and thanks so much.